Dr. Yoni Witten here. Last week I had on Dr. William Pollock and we talked all about PEMFs. This exciting technology has a ton of different applications in the body, with everything from helping you to resolve acute and chronic pain to speeding up your body's capacity to heal and regenerate all different types of tissue, talking bone tissue, connective tissue and cartilage, and even nerve tissue. It can also do some pretty incredible things for boosting your overall health. So if you didn't see that interview, go back and check that out. This week, I brought Dr. Pollock back to answer the flood of questions that I got about PEMFs following that episode. Let's get into this. Thank you everyone for being here. There was so much interest from the last interview that we did with Dr. William Pollock that I invited him back to do a Q&A to answer some of the questions that I received from you guys. So we're going to jump right into this. The first thing that I want to start off with, just a very basic question, is what are PEMFs?
So PEMF stands for pulsed electromagnetic fields. So they're pulsed. They're actually moving at a certain pulse rate. Anytime you create a magnetic field by having current flowing through a wire. And it's what we call the right-hand rule. So my thumb is the flow of the current. And every time you have a current flowing, you automatically, based on physics, automatically generate a perpendicular magnetic field. And that's called the right-hand rule. So the current flows in this direction and the magnetic field flows in this direction.
Okay.
So with every pulse of that current, right, then you get a magnetic field. As it peaks, as the pulse goes through, you get a magnetic field. And it collapses, goes back on itself.
Okay.
It doesn't go out into space like radar, television, microwaves, and so on. It stays attached to that wire, essentially.
Okay.
And then you take that wire and you put that wire on a body. And then that magnetic field then goes through everything except metal. Nothing blocks a magnetic field. So this magnetic field, as it's pulsing in and out, is pulsing in and out of your tissues. Okay, it goes right on through the body as if it wasn't even there.
Amazing. And so that's the effect is to sum up, is it's an electrical wire, and every time it gets a pulse at whatever the frequency is set at, it's giving off a magnetic field with every pulsation, and that magnetic field that's generated from the electrical pulse is what creates the effect in the body. Is that right?
Correct.
Very nice.
It's the magnetic field that then creates all kinds of downstream actions in the body.
Fantastic. And that's going to segue directly into our next question, which is from Lisa. She said, Dr. Pollock, I read your book, Power Tools for Health. PEMF seem to be helpful for so many different things, but when people ask me, I still have a hard time explaining what they do in the body. What's an easy way to explain this to a layperson?
Probably the easiest way to explain it, there are probably a lot of different mechanisms from a physics perspective to how PEMFs work. But the one that's been clearly proven, well established, is that as the magnetic field is passing through the body, it's interacting with the ions in the body, the electrolytes in the body. Mm-hmm. And that's another principle of physics. Electrical and magnetic go together. So if the body is electrical, not only in terms of the currents flowing down nerves, but there are currents flowing down our arms. When we do this with our hand, we're creating significant amounts of current flows in the hand, in the arm, at the rate of about 30 meters per second. Well, you pass a magnetic field through that, it interacts with the current. That's electromagnetic. And in the body, basically, it's subject to Faraday's law. The body will produce charge. So when a magnetic field is passing by a potential for charge, the ions or the electrolytes in the body, as the magnetic field passes through, it's stimulating, jiggling those ions and the electrolytes.
Okay.
Well, what does that do? It creates electricity, creates charge. Yeah. Okay, that charge is then responsible for all the actions that happen in the body. As the magnetic field is passing through the body, it doesn't pause, it doesn't get used up. You know, the intensity can decay over time, but basically it doesn't get used up. So charge is the key. Okay. The production of charge then gives the body the energy it needs to do the work the body needs to do. And when we get sick, we've been overpowered or we've been overwhelmed by the problem. Mm-hmm. And the body couldn't marshal a strong enough energetic response to that problem to be able to deal with it.
Okay.
Okay, so if you got a flame, you pour water on it. Gone. right? Well, magnetic fields basically increase the body's ability to simply quench the problem or the process.
So if we were to take a prime example now with everything going on in the world, and the people that seem most susceptible to, say, a COVID-19 situation are the elderly, because they have less energetic resources to mount a sufficient immune response. So the effect of a pulsed electromagnetic field on a cellular situation like this is it's ramping up cellular energy and enhancing the body's capacity to do what it already does. Is that fair to say?
Absolutely. And the magnetic field doesn't do the job. All it is the stimulus.
Okay.
The body does the job.
Body does the job. So it's like, it's just filling the body's battery, so to speak, so that it can do the work that it needs to do.
Perfect example. And that's correct. The body can only do what it can do. And the magnetic field will simply give it the opportunity. The body has to do the work. As you say, the battery gets full, and that's the end of it. Now, so if the problem requires more juice, if you will, than what the body can produce, well, then we still have a problem.
Well, that's very interesting. So now you have a situation where it's like, you could think of the body as like, say, an electric vehicle, and every day when you get home from driving your electric vehicle, you have to plug it in.
Charge it.
So the PEMF machine is the equivalent of plugging your electric car in at the end of the day.
Effectively, you're doing that. Effectively, you're doing that.
Very interesting. I have a question here from Abir. She wants to know if there are any side effects or contraindications to using PEMFs.
So PEMFs have been found to be extraordinarily safe, even at extremely high intensities. So the biggest challenge with PEMFs is, the rule is, PEMFs, therapeutic pulse magnetic fields, do not cause problems. They reveal problems.
Can you explain that, Bill? What do you mean by that?
So what happens is that as you're passing the magnetic field through the body, it's stimulating tissues. And when it does that, the body has to be able to handle that stimulation. It has to be able to produce the energy that it needs to do the job.
Okay.
In effect, magnetic field therapy is like athletic training. You don't get off the couch and run a marathon tomorrow. You got to train. So the tissues have to be able to amp up their ability to deal with the problem. And you're giving the tissues that energy, but it's got to repair, it's got to recover, it's got to rebalance itself. And that process can take some time. So if you try to do too much too fast, then you get into trouble. I'll give you an example. I had a young guy who lost his scholarship for playing hockey. He was a goalie for the Midwestern universities. Had a groin injury. He tried all kinds of things for a couple of years. And then finally I met him. His father introduced me to him and says, my son has a problem. He can't play. He lost his scholarship. He's not back. He's not at university anymore. So can you help him? So I said, sure, let's try a magnet, because he didn't try magnets up to that point, magnetic therapy. So we got him a small, portable, battery-operated magnetic system. And within a week, he felt normal.
Wow.
After 2 years of battling this problem. Now, so that's good news. The bad news is he felt normal. So and what does a young guy who was a former athlete do?
Start going 100 miles an hour.
Trying to be normal again.
Yeah.
So he started training like crazy.
Yeah.
Bang, right back. Actually, he was worse off than he was before.
Wow.
So that's the problem.
Sure.
Is that his tissues were not healed enough. They hadn't caught up enough. They hadn't been trained enough by the magnetic field to be able to sustain demand.
Well, I wouldn't consider that a contraindication to PEMF.
That's true,
somebody who didn't follow the contraindication. Yeah, he didn't follow the proper rehabilitation protocol.
Exactly.
Okay.
But people consider that a problem.
It is a problem, but it's not a problem with PEMF.
It's not caused by the PEMF.
That's right.
So the true contraindications for PEMFs have to do with interference with electronics, primarily.
So like a pacemaker situation.
Pacemakers, implanted defibrillators, implanted glucose monitors, implanted wires into the brain or into the nervous system to help with pain management. So yes, those are areas where you can have the potential for the magnetic field to interfere with the circuitry.
Okay.
But more and more and more implant electronics are becoming what we call MR conditional.
You had mentioned that.
You can't do an MRI with them.
Yeah, you had mentioned that in our last conversation. So even with implanted devices, it's becoming a less of a problem over time.
You have to be careful. You have to know
sure.
what you're dealing with. You can't just sort of run into a magnetic system and be, maximum power right now.
Sure.
You have to do what I call going low and slow. Gradually build up the bodies. You have to see what the body's telling you it can do. Okay, we don't tell the body what it's going to do, because that doesn't bode well most of the time.
Sure.
If it's excessive, at least. So so that's the primary contraindication. The only other contraindication that I have is transplants.
Okay.
And the reason for that is I can't predict the direction of the response of the magnetic field relative to that person's immune system. And we don't want to enhance the immune system when they're on immunosuppression.
Understood. Yes. So
it may be safe, but I recommend that you don't test that.
Yeah, don't mess with it. Better safe than sorry. I understand. So the short answer for side effect or contraindications is implanted devices and organ transplants.
Correct.
Okay.
And then there are other areas where you have to be cautious.
Okay.
You don't
What
have
are those?
It's not a contraindication.
Sure.
So for example, if you have a huge amount of inflammation going on in the body,
okay,
magnetic fields will help you to dampen it, but temporarily what you do is you increase circulation.
Mm-hmm.
And when you increase circulation to an already inflamed area, what do? You increase inflammation.
That's right.
Right? But that's the body's response to being able to heal itself.
Mm-hmm.
So that's a relative issue. Mm-hmm. And for some organs like the thyroid, if the thyroid is inflamed, if you have thyroiditis and you have Graves' disease, mm-hmm. which is a form of thyroiditis, that's producing way too much thyroid hormone. So if all of a sudden you start stimulating that gland, you start increasing the circulation of that gland, all of a sudden you can get an increase in inflammation. Mm-hmm. And that, if you increase inflammation, and even if you increase circulation to that gland, all of a sudden it's producing way too much thyroid hormone.
Okay.
Right? So you can treat thyroiditis, like Hashimoto's thyroiditis, that's basically not active and overproducing hormone. It's really when the thyroid is overproducing hormone that you run into trouble.
Okay.
You might run into trouble. You won't necessarily always run into trouble, but you have to be very, very cautious. And you have to monitor your thyroid levels regularly.
Okay. Okay.
Those are the primary things. The only other thing is magnetic field therapy does decrease clotting.
Okay. Which
most of the time is a good thing.
Sure.
But if you just had surgery and you have a big open wound, mm-hmm. Magnetic field therapy may cause that wound to ooze blood. Mm-hmm. Because it thins the blood. It thins the blood and it decreases the stickiness of platelets. Most of the time, that's a good thing. Mm-hmm. But under certain circumstances, again, you have to be careful. So, unless the wound is controlled, the bleeding is controlled completely, then I'd back off on the magnetic field until finally that bleeding is controlled. Then you start doing the magnetic field to accelerate the healing of that wound.
Okay. Very nice. So this question actually segues right into what you were just talking about. Christine wants to know would this help with systemic inflammation, thereby helping metabolism? Would only a large unit work if this indeed will help it? And has there been any research about PEMFs being used for generalized inflammation?
Yes, and that's covered in my book. I recommend PEMFs for autoimmune diseases all the time. Caution, go low and slow. Okay. And generally speaking, if you have an autoimmune disease, it isn't in one place in the body. Mm-hmm. Right? It may manifest in a joint like rheumatoid arthritis that's bothering you particularly, but it's a systemic disease.
Sure.
It's a systemic condition, can involve any joint in the body. Therefore, to truly control it and to truly deal with the damage and keep the tissues as healthy as possible, a whole body system would work better.
Okay.
Now, I have a blog that I probably mentioned in our talk about adenosine.
Yes, you did.
So that people need to read that blog to truly understand how PEMFs help with inflammation.
I'm going to put a link. I'm going to put a link to that blog in the description for this video.
That's critical, and that's not in the book, by the way. So that you have to read that separately.
You mentioned that last time. Yes.
All right. So the answer to your question is yes. You need a whole body system.
Okay.
And the depth of the inflammation becomes really important. So if you want to use the information in that blog, that tells you the kind of magnetic field intensity you need to treat all the tissues in the body.
Okay.
At various depths.
So a person who's dealing with generalized inflammation needs to look in the blog or check the description in this video, and then say the inflammation is manifesting in the knee or it's manifesting inside the shoulder. And then that person will also have to take into account how big their body structure is so that they can get an idea of how deep they'll need to go, which will tell them, according to the graph on that blog, how strong of a system they need to purchase to get the effective dose to the tissue. Is that correct?
To the target tissue.
Okay.
Now, if you have, again, an elbow or a knee bothering you, and that's your primary reason to go into a chiropractor or a doctor or a physical therapist or orthopedic surgeon, whatever, that's not your only problem, right?
Sure.
So you're going to want to treat that problem, but you have to think about the whole body. So in that case, you want a magnetic system that has the capability of doing whole body management to keep you healthy and decrease risk, but you also want something that's going to treat a local problem. So you need a whole body and a small applicator as well.
And just to clarify here for the people listening, most of the larger systems that include, say, call it a whole body system, there are optional or included smaller attachments that allow them to treat small areas.
Exactly.
Okay. Rosanna wants to know, is it possible to find out how long PEMFs should be used for a specific issue? In other words, treatment times. For example, she's dealing with knee pain, and she also wants to know, is there access to studies that have been done on PEMFs so that she can discover how long it should be used for specific problems?
Well, I get into some of this to some extent in the book.
Sure.
And the problem is that for your particular problem, there may or may not be a study. For your particular problem, there may be a ton of studies. Going into the research is not necessarily going to help you because research is limited by a lot of things. It's limited by the money available, by the resources available, by the willingness of the people to do the research. For example, I did a study at the University of Virginia. I was part of a study. And we had a whole body magnetic system that was very weak. And we knew that because it's weak, it's going to have to be used for longer periods of time. And because it was needed to be used for longer periods of time, people didn't do it.
I see.
And as a result, they didn't get good results.
Which highlights the benefits of those more powerful systems.
The more powerful systems.
Shorter treatment times.
Your body's going to tell you how much your treatment time needs to be. So we can be somewhat prescriptive, but ultimately, when you go to a doctor and you get any kind of treatment, you get a drug or whatever, that's an experiment.
Yeah.
Right? A manipulation is an experiment. Physical therapy is an experiment. You apply the technology and then you see how the body responds.
Sure.
If it doesn't respond well enough, you either increase the number of treatments or you increase the treatment time.
Sure.
Or you go to a different modality.
Sure.
Right? So you make adjustments in your treatment protocols based on how the body responds.
Absolutely.
So the body will dictate what it's going to be able to do and how fast you're going to get better. Now, in the book, I provide some of that information, but I'm going to tell you right now, I have a secret. Maybe I've revealed my secret.
Another book coming out.
There is another book coming out.
Yes.
So it'll be out probably by the end of the year. It's called Supercharge Your Health with PEMFs.
Nice.
So the first book's called Power Tools.
Yeah.
Now we're calling it Supercharge.
Very nice.
All right. And that book will have a lot more practical information on selecting a system. We've got over 80 different health conditions, and they tell you what kinds of magnetic systems you're going to need to treat them. Okay. And then there's some basic protocols within the book for about 80 different conditions.
Very nice.
Once you look across that spectrum, once you've read all the different ways you can treat the body, you then begin to get a sense of how you should approach your problem.
Yeah. And the one thing that I would add to what you're saying, Dr. Pollock, is that when I purchased my PEMF unit, your company sent over a user's guide that explained the different programs of the Flex Pulse and say, this one is better for enhancing sleep. This one is better for musculoskeletal conditions. And then basically it's just a matter of selecting the right program. And then the Flex Pulse does what it does.
Does what it does. And then you work with it and you see, whether you could do less time or more time.
Sure.
Very often, just like with physical therapy, you may have a lot more treatment time at the beginning as you initiate a healing process. And once you've initiated the healing process, after that is basically maintaining the tissue. Sometimes you'll cure it, which is actually not that common for chronic conditions especially. But at the very least, you can maintain it.
Sure.
So if you back off and you forget or you go away, your body will tell you whether you, like the hockey player, whether you will have healed the tissue adequately.
Sure. So, I mean, I tell my community this all the time. Pain is your body talking to you.
It's
So
revealing the problem.
yeah, it's basically guiding you what to do, but you need to know how to pay attention and speak the language so that you can provide the appropriate response.
And just dealing with the pain by itself is, it's a worthy goal.
Sure.
But while you do, PEMFs can help with pain.
Absolutely.
But the pain will come back.
Mm-hmm.
So the goal is not only to improve the symptoms, the goal is to improve function. So function tends to take longer, recovery of function tends to take longer than symptom reduction.
Yes.
But even that will go away if you stop treatment too soon. So healing takes a lot longer, and it depends on the tissue, like ligaments heal at a different rate than muscle or skin.
Sure. Yeah, the other thing that really excites me about PEMFs is it's one layer that we use in a multi-layered approach. So it doesn't replace rehabilitation. It's an amazing adjunct to rehabilitation because you can keep the person pain-free while you're rehabilitating them to speed up that gain of function that you're talking about.
Right, gain of function.
Yeah, well, I used bad terminology
yes.
there.
Yeah, we don't use it that way. Yes.
While you're
a positive gain of function.
Well, I mean, if you're trying to sustain that virus, then gain of function is a good thing. Yeah, what we're trying to do is return the body to normal function.
Exactly.
So I have a very specific question here from Rosa. She says, 5 years ago, I bought a professional IMRS 2000 whole body PEMF system with the spot pillow and the acupuncture point pen device.
Right.
How does it compare to the Flex Pulse? Should I buy the Flex Pulse or does the IMRS 2000 suffice? Will both help to build cartilage around my knee?
There was a review study by Dr. Hug, and it's discussed in the Power Tools book, about low intensity PEMF systems. And I spent a good part of my magnetic career working with low intensity because that's what was available at the time. Mm-hmm. The QRS is a very low intensity system. It's less than about 1 Gauss. So in the blog on inflammation, optimally, you need 15 Gauss to deal with inflammation. So right there, you're starting with 1 Gauss. Mm-hmm. So what is that going to predict for you in terms of the benefit that you're going to get?
I mean, unless you're using it all day long, every day, you're going to get a sub adequate response.
Yeah, you'll feel better because that system will help with the acupuncture points. Mm-hmm. And it makes you feel better. That's good. But again, the probability of reducing inflammation deeper in the body drops dramatically when the intensity drops, to a low below 15 Gauss. So the Flex Pulse is 200 Gauss for one applicator. Now it comes with 2 applicators. If you split the 2 applicators, then each one is 100 Gauss. So that's still 100 times stronger than the IMRS.
I see.
Or the QRS or Beamer or many of these other whole body systems. Mm-hmm. They're not strong enough. You have to know the intensity of that system. And the person selling it to you should know that, and they should tell you that. But they often don't know, and they don't want to tell you.
So the short answer is though the IMRS can make a person feel better, the amount of power that it's pushing is not sufficient
to do significant healing.
Okay.
It can, but it's going to be slow, it'll be low, and it may or may not work for you. So if you use it and it works, hallelujah. Okay. But still, the Flex Pulse has the advantage of being battery operated.
Sure.
Right? It can run all night. And if you're trying to, I use it for the brain, for sleep myself, because it's 200 Gauss. If I put it under my pillow, if I got like 3 or 4 inches of pillow, then my brain is still going to get a significant amount of stimulation. Mm-hmm. And even though I don't need to treat inflammation per se, the higher the intensity, the quicker the effects on the brain that are going to be in terms of slowing down the brain and helping with sleep. Mm-hmm. For pain as well, if you're treating the IMRS pen mm-hmm. for an acupuncture point, it's very weak. Mm-hmm. You could take that one single coil of the Flex Pulse and put it over an acupuncture point, and it's going to be 100 times stronger, 200 times stronger.
Yeah.
So it'll do a lot better, faster action and produce better results faster.
That's the perfect way to sum that one up. So there's the clear answer for you, Rosa. Anatolian has another very specific question. What PEMF protocol and machine would Dr. Pollock recommend for ligamentous laxity in the SI joint? Turns out she fell 20 years ago. The pain was mostly low and intermittent until about a year ago when it became more frequent and intense. Increased pain is probably due to caring for a sick pet, which required picking him up several times a day. After her beloved pet passed away, the pain increased, but now there's a lot of popping and clicking in the joint. She uses a seat wedge because she has less pain when she's standing. Yes. So she wants to know what PEMF protocol and machine would Dr. Pollock recommend for ligamentous laxity?
Probably not.
Probably not.
So the question is why?
Why?
Even though PEMFs can increase collagen,
Mm-hmm.
it's a slow process.
Mm-hmm.
Once the ligaments or tissues are stretched, then what happens is you have a joint that's loose.
Mm-hmm.
So magnetic field therapy can help with the pain, can help with whatever secondary inflammation there is because of the movement of the joints. But it's not going to typically, I would not normally expect it to repair the ligamentous laxity. There are other technologies that work better for that. Prolotherapy is a good example, where I would tend to use prolozone or prolotherapy. You have to go to somebody who does that because that causes inflammation in the tissue. Here we're causing inflammation because what that does then, it causes scarring, which then shortens those tendons and ligaments around that joint. Now, that will tend to bind it better. Although I've had people say that, and chiropractors have told me themselves that their treatments hold better with magnetic field therapy because the tissues are strengthened and stronger. They're not as loosey-goosey, if you will, but it's not a cure. So, and because if you don't repair the actual tear, you don't repair the loosening of the laxity of those ligaments, then you're basically just in a holding pattern.
Okay, so that's a very honest answer, Anatolian. What Dr. Pollock is saying is that PEMFs may not be your best option and that you might look into prolotherapy. I would add that looking into a good structural rehabilitation program would be very beneficial. Make sure that the pelvis is balanced and then strengthen the surrounding muscles. She also asked about an SI joint, which would be fantastic for adding stability in the short term and supporting the process that Dr. Pollock talked about of increasing scar tissue by adding inflammation to help stimulate the healing response via something like prolotherapy. So very good answer.
And you can still use magnetic field therapy for help with symptoms.
Sure.
While the prolo is working, because it may take multiple prolo treatments to be able to get benefits.
Sure.
So if you have a magnetic system, use it. There's no harm. There's no contraindication in the setting of prolo.
Absolutely.
Try.
Yeah. Good
So
answer.
the machine that I would use if you're going to do magnetic field therapy in that setting would be a higher powered machine. The Flex Pulse could work because the SI joint is relatively shallow
Sure.
into the body.
Yeah.
So 100 Gauss or 200 Gauss applied over the SI joints with a little coil over each one, worn for hours at a time. Probably the easiest way to deal with this would be to wear it through them all night.
Nice.
Just tape it to the underwear or pajamas right over the SI joints and let it run all night. And then you could add on to it during the day as you need to.
Very nice. Barbara says, I fell on December 24th, 2019 and had an intra-articular fracture of the distal radius, distal right ulna, and a broken shoulder. The shoulder is okay now, but I've ended up with a malunion of the wrist. This one is very interesting. 2 torn ligaments, and she's guessing that she has nerve damage because there's extremely intense pain. She took gabapentin for a year, and now she's switched over to Lyrica, but still has very little relief. 3 doctors suggested carpal tunnel surgery, which she had on May 11th of this year. But she ended up, as is the case, with much more intense pain. Do you think that PEMFs could help?
I would tend to say probably amazingly so. Now, is it going to remove the problem right away? No. So historically, the FDA approved PEMF therapy for non-unions. But most of that time, those devices were approved for long bone fractures that were non-unions, that didn't heal. So a wrist fracture is a lot better, a lot easier to work with. And that's where the flex pulse can, again, become very, very helpful. But you have to tape the magnet to the wrist, hold it on with a brace or some other apparatus, and then have the control unit nearby or up into a pocket, and then just run it for hours at a time. Now, in those studies done with the FDA, they were using magnetic systems that were about 50 Gauss.
Okay.
And the frequency doesn't matter so much, but it was about 50 Gauss. In the case of the flex pulse, I would use it at 10 hertz.
Okay.
And then put it right over the non-union and wear it all day.
Okay.
In that study, the original studies, they were wearing these magnets for 12 hours a day. Now, some people could get by with wearing them for about 4 or 5 hours a day. So this is, again, where use during the night becomes easy because you're sleeping anyway, you're in one position, and then just wear it continually. Then what you do is you monitor your symptoms. And if your symptoms are improving, then that's keep doing what you're doing. But if they're not improving, then you have to increase the time. The other thing you can do with the flex pulse coil is you can double up, you can pancake the two coils. That goes from, so one coil is 100 Gauss, two coils is 200 Gauss, or one single coil is 200 Gauss. But if you stack the two coils, it's 240 Gauss.
Wow, I didn't know that.
Right? So you're adding the two sets of fields together.
I haven't tried that with my unit yet. Now I'm going to try it
by stacking.
Okay.
So one is going to get 200 Gauss. Separately, it's 100 each, but stacked, it's 240 Gauss.
Wow, another application for the flex pulse that I wasn't aware of. Thank you for sharing. So the flex pulse in Barbara's case has the potential to help with the non-union, has the potential to help with repairing the nerve damage because the research on increased objective measurement of nerve functionality with using PEMFs is one of the most fascinating applications to me and very exciting applications as a practitioner. And then also with the more intense pain that she ended up with following her carpal tunnel surgery, it could help on multiple
levels.
Yeah.
There's a warning about the nerve pain. It may help with the nerve pain itself, but it can come back dramatically until you repair the nerve. Nerves repair extraordinarily slowly.
Sure.
So it depends on the amount of damage on the nerve. And whether it's the trauma or whether it's the inflammation afterwards or whether it's the scarring that's going on in that joint or that area. Because the scarring itself forms adhesions, and the adhesions clamp down on nerves, which then aggravates the pain.
Absolutely.
Unfortunately, the only way to really release that would be with surgery. So the nerve pain problem, if it goes away quickly, hallelujah. If it doesn't, be patient. It may take you a year or a couple of years of treatment to really significantly damp down that nerve irritation.
And I would just add to what you're saying there that there are some very simple nerve flossing techniques that can be very effective in helping to break up adhesions that have formed in the sheath around the nerve. So fine, again, combining PEMFs with an active rehabilitation and finding somebody who can guide you through that relatively simple nerve flossing techniques, Barbara. So that would be a good recommendation.
And also nutritional antioxidants, nutritional anti-inflammatories, fairly high doses of those as well will go a long way to helping.
Yes, and serapeptase to help break up scar tissue. Yeah, another good.
Well, serapeptase would have to be applied locally as a paste or a cream so that it could get absorbed into those tissues.
Well said. Very, very, very complete answer for you there, Barbara. Thank you, Dr. Pollock. Gary wants to know how can PEMF's pain-killing effect in the body be explained simply? He's having trouble understanding it.
In a lot of ways. First of all, magnetic fields have a natural opioid effect. They work through the opioid receptor, the mu receptor.
Yeah, you mentioned that the PEMFs was equivalent to a standard adult dose of morphine. About
10 milligrams, even in snails.
Wow.
Right, so you don't even have to be a human to have that benefit. So that's a natural pain-killing effect, number one. What causes the pain? You have to go to the causes of the pain. If you go to the causes, then you deal with these things that are causing the pain to happen. So inflammation is a common cause. Lack of blood supply is a common cause. Damaged nerves is a common cause. So there's lots of reasons for pain to happen. Magnetic fields can help with all those reasons potentially. So that's not just pain directly itself. We have to consider the cause. And then magnetic fields also have a cannabinoid effect. They can work together with CBD or marijuana to actually produce even better pain-killing effects.
Wow.
And so there are a whole host of biochemical mechanisms or actions that contribute to the pain-reducing mechanism of PEMFs. Okay. And that's a good thing. So it's not a single approach to dealing with the pain problem.
Well, that helps to explain why it's been shown to be effective with so many different kinds of pain conditions.
Exactly.
Okay. So to reiterate what you're saying there, PEMFs kill pain via multiple biochemical pathways in the body, which gives it a broader range of possibilities as far as what it can be beneficial for.
Beneficial. So that goes back to a point that I don't know if I made before in our discussion, is that the body chooses what it's going to do. Mm-hmm. Right? You may not get rid of your pain, but what you may not know is that the magnetic field therapy is healing the tissue. Mm-hmm. And if you don't heal the tissue to the right point, you're not going to have the pain reduced. Mm-hmm. So again, if you're not dealing with the cause, all you're doing is helping with the pain. If all you want to do is just deal with your pain, just take an opioid. Mm. Right? Just take ibuprofen. Mm. If all you want is just to reduce the pain, but they're not going to solve the problem. So my goal has always been to solve the problem to the extent possible. Mm-hmm. And give your body a fighting chance.
Well, that's it. I agree with you 100%, speaking as a practitioner, but for the lay person, we could definitely have a situation where a person is in a pain situation where it can't be resolved. And even in that situation, PEMFs come out far ahead of opioids and non-steroidal anti-inflammatories because the side effects are next to non-existent.
And there is another important side effect with chronic analgesic use, including SSRIs and muscle relaxants and so on, is that they rob the body's ability to fight viruses and cancer, mm-hmm. called natural killer cells. Mm-hmm. So research has shown all these things, all these treatments, while you're treating your pain, you're actually at the same time robbing your body's ability to defend itself from cancer cells and viruses through natural killer cell reduction.
So that, I mean, that you highlight that PEMFs are superior on a number of different levels. Not only can it kill pain through multiple biochemical pathways, it can actually work to resolve the problem, charge up the body's internal batteries, and enhance its ability to function in everything that it does.
Sounds like a miracle.
It does. And that's one of the reasons I went out and bought that really big full body system, which I'm super excited to get and try out. One thing that I would mention, I spoke about it very briefly in our last conversation, is my mother had taken my Flex Pulse in preparation for hip replacement surgery that she was having. She used it 3 weeks leading up to the surgery, 5 hours a day on the appropriate program, which you and I had discussed. And her results from that surgery, I don't know if I mentioned it to you, were absolutely phenomenal. She was up and walking and going up and down stairs within 18 hours of the surgery. She is now 3 weeks out, and she sent me a video last week of her dancing. She's transitioned already from using a walker to a cane and now walking completely unassisted. My family went over to visit my parents last Friday, and my mom walked a quarter mile down the street to play with me and my daughter, and then we walked all the way back. She did the whole thing by herself. So, and she's only had to take pain medication 2 times in 3 weeks. It just.
And how old is she?
She's 75 years old.
That's amazing.
It's absolutely incredible.
And we hear these kinds of amazing stories all the time.
Yeah. Yeah. You were mentioning something to me about a neighbor of yours.
Yeah, I had a neighbor who had to have a quadruple bypass or quintuple bypass. And you know what they do with those bypasses? They cut your chest open.
Yeah, crack the rib.
Right, and then go into do the work they have to do with the heart. They have to strip arteries or veins from other parts of the body, which is also painful, and put that into the heart. Well, normally it takes weeks to recover from one of these, and normally these patients are on pain medication for likewise could be several weeks. With magnetic field therapy, before the surgery and after the surgery, he used pain medication for 1 or 2 days. That's it. Wow. And his physical therapist couldn't understand. His physical therapist was pushing him to do more because he expected him to be worse. So his physical therapist was not pushing him enough because he expected him to be worse. But he excelled. He blew through his rehab, and the physical therapist was like, amazed, jaw dropping.
Wow. No, it's It's very impressive stuff. Ronnie wants to know, Dr. Pollock, thank you so much. I'm very interested in this therapy. Several years ago, I was diagnosed with moderate osteoarthritis in my hips, which causes severe pain in the soft tissues up and down my legs, into my knees, ankles, and feet. I've not had a pain-free day in years, nor a decent night's sleep. I'm 69 years old, and other than this, I've always been in great health. Would you recommend treating the hips alone, the entire leg, or the whole body? Which unit would you recommend for this issue?
So very often people will treat the area where they feel the pain because they think that's where the problem is.
Sure.
But we know it's probably not the problem. It may be, but it probably isn't. It's probably what we call referred pain. And there's another kind of pain called trigger point pain, which has a different referral pattern. But when you talk about a hip, with that kind of pain distribution, most likely it's coming from the hip, but it also may be coming from the spine. Because when you have hip pain, right, what does that do to your spine? You change your mechanics.
When the hip stiffens, the spine generally compensates and moves too much, and then you end up with injuries because the spine is doing more than it's supposed to.
And with the 69-year-old, you would not be surprised if there was arthritis in that spine as well, because if you have arthritis of the hip, there's a good chance you have arthritis of your spine and or disc disease. So this situation probably ends up being a compound problem. How often do we see hip pain referred down the leg? Yes, you can. The hip refers to the knee. But if it's going down farther than the knee, there's a good chance the problem is actually coming from the spine and the spinal cord. So you'd need to treat, I think, both areas. I need a high enough intensity magnetic field. But again, if you have arthritis in your back and your hip, where else do you have it? And at your 69, what else do you need to keep you going and healthier? You need a whole body magnetic system. So you need a higher intensity, whole body magnetic system with strong local applicators. The ideal system in somebody with arthritis of the hip is that because you got multiple areas that are a problem, you need a system that's going to allow you to use two applicators at the same time that are relatively high intensity, treating the spine and treating the hip.
Okay.
And then doing whole body. The best system that we have right now for that is called the PARMEDS Ultra Flash. Most other PEMF systems, there are a number that also allow you to do that magnetic sandwich, the dual applicator approach, but they're often more expensive than the Ultra Flash. So the Ultra Flash is my go-to system right now because of the rapidity with which you get results. The cost is actually, for a system like that, the cost is amazingly low. Although $8,000 is not amazingly low, but it could be more.
Yeah, well said. The other thing that I would add to Dr. Pollock's response, Ronnie, is that there's severe pain in the soft tissues up and down your legs, knees, ankles, and feet. You were diagnosed with osteoarthritis. I have a suspicion that that diagnosis was made off of imaging, and I would urge you to get a functional assessment to see if there's any other issues, like Dr. Pollock mentioned, with this being a compound problem, meaning there are multiple factors that are contributing to your pain condition. And there's a possibility that addressing some of those functional issues could make your pain subside significantly.
Well, but to go to that question, if you go to a conventional doctor, if you go to an orthopedic surgeon, I can tell you as a physician and having run medical groups, doctors have limited time. And what they'll do is they'll focus on what you came with. They'll focus on that problem, and they don't think in terms of the bigger picture. So functional chiropractors, functional medicine doctors will tend to think of the whole person, because there may be one key factor that's elsewhere in the body that has nothing to do with your hip or your back that it could be contributing to the problem. If you don't take care of that, then nothing's going to work well.
Very well said. Words of wisdom from Dr. Pollock, Ronnie. I hope you heard that. Ginger has a question. Also 69 years old. She's questioned about her shoulder. She just found out she has shoulder pain. Is not from an injury, but it's being caused, again, she says, by moderate arthritis in the left shoulder. Will PEMFs help diminish this type of pain? Will this technology also help the arthritis to go away? Which of the units should I buy for my problem? I just want to jump in here, but before you knock this one out of the park, Dr. Pollock, and say that the last thing that we were talking about with Ronnie should also be applied to Ginger, in that she should get a functional exam and see if there's anything besides what can be seen on imaging that's contributing to her problem. And now I will let you take this away. This is a left shoulder problem. There's moderate osteoarthritis present. Will PEMFs help to diminish this type of pain, and will it help the arthritis to go away? Which units would be best for her?
If we truly can establish that it is an isolated problem, like say arthritis of the acromioclavicular joint, that's a use problem. It's a disuse problem, right? Using the shoulders, using too much, and then getting arthritic changes there. If that's the only problem, then you could do local treatment very easily. And a flex pulse could do the job very well.
Because that joint is so superficial.
Because the joint is so superficial. Now, if it isn't that, then you have to think about the other areas that you need to treat at the same time. I happen to have AC joint arthritis myself.
Okay.
And periodically, when I lay the wrong way in bed, it'll let me know. So I would need to be treating that basically every day for several weeks at least to quiet everything down. To reverse the arthritis is very challenging and very difficult. Most of the time, let me give you out of the book, I wrote about our guinea pigs.
I remember they were the treatment times were upwards of 6 hours a day in that study.
Correct. And guinea pigs have a metabolic rate that's about 20 times a human.
Wow.
They only live about 2 years, and 100% of guinea pigs living in a cage will get arthritis. 100%.
Interesting.
Right? But they develop it rapidly. They also can potentially reverse it. So they did a study where they compared guinea pigs that got magnetic fields in their cages and guinea pigs that were left to nature, the natural progression. What they found is the guinea pigs that had the magnetic fields, when they died, they were actually showing healing of the arthritic process, including resorption of the bone at the edges of the arthritis.
Wow.
Right? We call that lipping. Right? So you have that bone degeneration there. Well, they were showing healing. Now, theoretically, a human can do the same thing.
Sure.
But a human has 1/20th the metabolic rate of a guinea pig.
Okay.
So
could some of that be made up for using a higher power system?
Partially, but the body has to do the work.
Oh, that's right.
Right. So once there's a significant amount of arthritis there, and the metabolic rate of a human is so much slower, and the older you are, the lower the metabolic rate is as well. So then I don't practice. I don't tell people that you're going to reverse your arthritis. Cross our fingers.
Okay.
I mean, if you're young enough, you can. If you have a meniscal tear, right? Doesn't matter what you do with the meniscal tear, you're going to get arthritis, whether you get surgery or not. You're going to get arthritis in that knee. But what if you did magnetic field therapy on a regular basis? Will you get the arthritis?
We would have to do the research and find out.
Probably not, because there is some other indirect research that indicates that you can do this preventively. So treating it and reversing it when you've had it, when you already have it, is more challenging and more difficult than stopping progression.
Sure.
Right. So what we're doing in the AC joint case is we're decreasing the symptoms, we're decreasing the swelling, we're giving more mobility to the shoulder, more range of motion, more strength, and decreasing the pain. But it may take a long time to remove the pain to a point where it doesn't show up again. It may take months to years of treating that area with a local magnetic therapy device.
So if her moderate arthritis is in the acromioclavicular joint, because it's superficial, a flex pulse would be very effective in that situation. If it's a glenohumeral joint, the situation changes.
Correct. Bigger, you need a bigger machine.
Because the joint is so much deeper.
It's deeper.
Yeah.
So you're talking front to back or from the side in, you're talking probably about 3 inches at least.
Sure.
Right? Relative, depending on the size of the person.
Absolutely.
So in the case of the shoulder, I would treat from the front, mostly, depending on where the imaging shows most of the lesion to be. If it's arthritis of the AC joint and the anterior part of the shoulder joint, then that's the area you treat. If it's in the front and the back, it's across the top of the shoulder, then you're going to have to treat a bigger area. You need a bigger coil, bigger applicator to adequately treat that area.
And with the coil, you're laying it down on the front because of the right hand rule, correct?
No, that's not an unreasonable thought.
Okay.
No, it's because of the depth.
Okay.
Because the depth from the front of the shoulder is better than from the side of the shoulder.
Yes.
Right. This is a much deeper tissue to go deep into the joint from this side.
Okay. But as far as actually using the applicator, you wouldn't slide the loop around your arm, you would lay the loop on you. Is that accurate?
Well, you could. If you have a big enough loop, you can bring it up over your shoulder and lay it across the shoulder, because then the loop goes around front to back.
Okay.
Right. But if you have like a flex pulse coil, it's flat.
Sure.
You need to treat the area with the least depth.
Mm-hmm. Could you potentially, with a flex pulse, go in through the armpit to decrease the depth?
You have to look at the mechanics, and you have to look at where the lesion is.
Okay.
Yes, theoretically, that could, again, depending on where the lesion is.
Okay.
You could try that, but there's a problem with doing it there. Is the flex pulse coil is flat.
Yeah. It's
that
not
would
going to be
mean
very
right up against the axilla.
Yeah.
You're talking about only one part of that coil that's going to be able to treat that area.
Yeah.
I don't think that's going to be adequate.
But if it was like a humeral head, you could point the coil outward and get real close to that humeral head.
You could potentially. So a loop coil would tend to work better.
Okay. Yeah. It's a good point. But again, you're bringing up the complexity of the issue. We would have to say, so number one, Ginger, get a functional analysis and see if there's anything else that's contributing to your pain. Number two, it's going to be what machine you should get and what protocol you should use is going to be dependent on the location of the lesion, is what Dr. Pollock.
Or lesions.
Or yes, if there's multiples. Caitlin wants to know, she says, the information about PEMF sounds very intriguing and the book looks really interesting. I have just torn, parentheses, luckily a grade 2 and not a grade 3, a calf muscle while playing tennis. There's not much I wouldn't try for the pain. Also, I have other niggles as an ex-competitive athlete. Not sure if PEMFs are available to be purchased in the United Kingdom though. Looking forward to reading your book and watching the follow-up Q&A with Dr. Pollock. So what she wants to know, I'm surmising here, is can it help with her, the pain that she's experiencing from what sounds like a very serious calf muscle tear? And can she get a PEMF unit even though she lives in the UK? So
let me deal with the last one first.
Okay.
We routinely ship to the UK.
Great.
Many of our devices we either ship from the US or they are shipped from the manufacturers. So we don't have, on our premises, we don't carry all the devices in a shop, in a warehouse, and then ship from there. But the answer is yes. Magnetic field therapy is available to the UK easily. The bigger question is that you're talking about being an athlete. So you're talking, again, functional medicine, functional physical therapy, you're talking about needing to treat the whole body because you got lots of stuff going on in that body, even though it's not talking to you right now, right? So you got to treat the whole body. But to do the calf, again, because of the bulk of the calf, you may need a stronger magnetic system. If it's one specific spot that you tore it, let's say laterally, tore a specific muscle bundle, then that may be a lot easier to do with a very local system. But a bigger system is going to be required to treat the whole calf. And my experience with calf tears and calf bruises, calf like trauma, hits to the calf, etc., is that you get amazing results from magnetic field therapy. That's why I think you probably could solve that problem relatively quickly, but you have to think about everything else that you've got going on in your body.
Sure.
So a whole body magnetic system, preferably with a strong applicator. The ParMed's flash machines are the best value right now. The same as the Ultra Flash I mentioned. Well, they have less machines that do only have one channel, and they have fewer applicators, but they can be very effective as well.
Fantastic. So Catalin, Dr. Pollock is saying a high power machine will be super effective at solving your problem, and you will have no problem whatsoever getting it in the United Kingdom. Next question, Dr. Pollock. I had multiple people reaching out to me suffering from migraines, and they wanted to know what is the best way to use the Flex Pulse to help with migraines.
The Flex Pulse may not be good enough.
Okay.
All right. But if you have it, use it. Try it. So migraines are complicated, and a very large percentage of people with migraines have mixed headaches, which often are tension-related headaches. Okay. So then you treat the back of the neck. So which came first, the migraine or the tension? Mm-hmm. So sometimes if you treat the tension part of it, you decrease the migraine frequency anyway, severity and frequency.
And so a Flex Pulse would be very effective for treating it?
Would be very effective, applied over the back of the head.
Okay.
And
what setting would they use for that, Dr. Pollock?
Pardon me?
What setting would they use or program?
You could use either 10 hertz program or the 7 hertz program. Those are probably the best ones. Okay. At the highest intensity. Oh, with the Flex Pulse, almost all the time you're going to go to the highest intensity.
I was going to say mine has almost never shifted away from 10.
Yeah, if you have a problem at 10, then cut back to 5. If you have a problem at 5, cut back to 2, okay, and then gradually work yourself up. Sure. But if you don't have a problem with 10, if you don't get an overreaction to the pain problem, then that's your setting. Always go to the max, because you want to deliver as much magnetic field power into the tissues as you can to deliver at least that 15 Gauss that we mentioned.
Which, yeah, I want to reiterate for everybody watching that is dependent on the power of the machine. Essentially diminishes the further away you get from the applicator. So you need a machine that's sufficiently powerful to generate the necessary dose at the depth of the tissue that you're trying to get to.
Yes.
Okay.
And it falls away very rapidly as you move away from the applicator.
Which again is the graph that I'm going to include from your blog in the description of this video so that people can see for themselves.
All right.
So back to the migraines, you were saying that if it is a pure migraine, they may need a more powerful system, correct?
Correct. So if you have that smaller local system, try it. In this case, you probably want to stack those 2 coils on the back to increase the power. Because
that gives it a bump all the way up to 240 Gauss.
40. Okay. Versus 200 or versus 100.
Fantastic.
There have been lots of studies on migraine using PEMFs, but they were most often done with high intensity magnetic systems. There's a device called an ENURA, E-N-E-U-R-A, that is covered by insurance. Some insurances, not all insurances. And you have to do it every day, and it's more prophylactic. It's not as powerful as the machines that we carry, but it's been shown that a coil put on the back of the neck, worn for half an hour to an hour a day, decreases the frequency of the headaches, decreases the severity of the headaches.
And that's with a machine that's less powerful than a Flex Pulse?
No, it's actually more powerful.
Okay.
It is more powerful, but it's a prescription device.
Okay.
You have to get somebody to prescribe it for you, and you have to have your insurance cover it.
Okay.
Okay, then it may be worth getting. But we have devices where it's not covered by insurance that are much stronger, so therefore should get the results much faster. Mm-hmm. So multi-flash, for example, Parmed's multi-flash has a magnetic field intensity of 4,000 Gauss. All right, and then it has what we call a loop coil that you can fashion into an elliptical coil or an oval coil and put it across the back of the neck. Sometimes that's not enough. Sometimes that works really well because that gets the blood vessels going up to the brain. In some cases, some people need the magnetic field directly into the brain. In that case, you could take that elliptical coil and put it from front to back, over the whole, so the whole brain gets treatment. In other cases, you could do it on the sides. Now, if you have a migraine that tends to start on one side, the key to migraine treatment is you got to hit it early. You got to hit it hard and early, because a lot of people sort of second guess their headaches. So it's going to go away, or I'll take an aspirin and it's going to go away. Well, then before you know it, you're like 3 hours later, now you got a severe headache. So my philosophy is with migraine, hit it hard and hit it fast. And that way you're going to reduce the frequency of attacks, you're going to reduce the severity of the attacks, and maybe even then prevent the headaches from happening at all.
Okay. So to sum up, Dr. Pollock, a lot of people with migraines have actually a combination type headache where they're having, say, a tension headache or a cervicogenic headache in combination with the migraine. Flex Pulse can be very effective for treating the cervicogenic or tension portion of the headache, but for classic migraines where it's starting on one side of the head and spilling over, where they're getting aura and nausea and vomiting and the light sensitivity and all the rest, they may need a more powerful system.
That's correct.
Okay, very nice.
Let's go back to that point. Even though people buy their magnetic device for a particular reason, we sort of touched on this earlier. This is a Swiss Army knife tool. You could use it for all sorts of things. So even though you have headaches as a primary reason, you may have other aches or pains, or you may have problems with sleep. So there may be other uses that you could have for it, whether it's for yourself or somebody else in the house, including your pets. So you're talking about a tool that you're investing in that's going to help you in a lot of ways for years to come.
That's a really good point. And maybe you can just touch on that. So for a person who goes out and purchases a Flex Pulse, it's not a small purchase. So it can help with those musculoskeletal aches. It can help with that acromioclavicular joint injury. It can help with that calf injury. It can help with that cervicogenic headache. You use it for sleep. My mother used it to help prepare the bone for a hip replacement, and then to help the replacement adhere to the bone. She continues to use it about 5 hours a day. The Flex Pulse is amazing because, like you mentioned, it's battery operated and the person can easily wear it and attach it to where they need the treatment and then go about their day. So there is a huge benefit to that form of treatment because, like you mentioned at the outset of this, if you don't do the treatment because it's too inconvenient or too large or whatever, then you don't get any of the benefits.
Correct. And your mother probably has other health issues. At age 75, you got to have other health issues.
My mom's you can't slow her down. She's amazing.
She doesn't complain, but that doesn't mean she doesn't have other health issues, right?
Well, you're not going to hear it from her, Bill.
Okay, good enough. Good enough.
So if you would just touch on what you started off there with what can a small PEMF device like the Flex Pulse, it's a Swiss Army knife. What are all the things that it can be used for? Just quickly rattled off. What are some of the most common things that people use it for?
Well, pain is clearly one of the most common. So any kind of injury, any kind of pain, it helps with bruising. It helps with infections. It helps vision. It can help with hearing. It can help the dental area. It could help a bladder. It could help a carpal tunnel problem. It could help a tennis elbow problem. So those are all pain syndromes. So you can use it. I've used it as well for people who have arrhythmias. So if you have atrial fibrillation and place it over your heart, it stimulates the heart to decrease the sensitivity of the heart to the stimuli that cause atrial fibrillation. And you may actually, over time, you may actually be able to heal the heart. Wow. Wound healing, autoimmune, inflammation. These are all the uses that are covered in that book, in the Power Tools for Health. But if you don't want to buy the book, which is actually a cheap investment, $26, I think, right?
Yes, highly recommended. I'm going to include the link for Power Tools for Health. My copy, you can't have it because it's all marked up.
Then you can see what he thinks, his touch points. So, but there's a ton of information on drpollock.com, which is free. Absolutely.
drpollock.com is a fantastic reference, and I recommend that everybody check that out. I really want to thank you, Dr. Pollock, for coming on and for taking the questions from my community and addressing all of them extremely thoroughly. I know that you're a busy man, and I appreciate your time.
I appreciate being here. I thank everybody for joining us and listening and learning.
And we have that special offer that's going to go on for about 25 more days. People that are members of my community can get 20% off on the Flex Pulse. Use the link in the description down below, enter code DRW, and Dr. Pollock and his team are going to get that out to you with free shipping, 20% off the normal price. For anybody who wants to get a consultation on what PEMF unit would be best for them and they're not sure, they can contact you directly. Is that right, Dr. Pollock? And you do free half-hour consultations?
On the home page, on the right side, the right panel, you'll see consultation. So you click on that, then it gives you a form that has to be filled out that you have to send back to us, and then you can book your consultation.
And they get access to you directly.
And I do the consultation. Well, actually, I have a team.
Okay.
One of the team members is a chiropractor, Dr. Marlene Mahipat.
Okay.
And pretty soon we'll be bringing on an acupuncturist to our team as well. So you'll have some options for people to get help from.
That's fantastic. Well, thank you so much again for your time, and have a great day.
Thank you too. You as well.
Thank you so much for watching. I really hope that you enjoyed this video and that you'll put the information to good use. If you want to find out more about what PEMFs can do for you, be sure to check the link in the description down below, where I've created a document that outlines some of the most impressive scientific results that PEMFs have shown for a variety of different health conditions. I also want to remind you that Dr. Pollock and his team are offering 20% off plus free shipping on the Flex Pulse, that's the same unit that I have, when you enter code DRW, that's Dr. W at checkout. Use the link down below to access that special offer. I hope that you take advantage of it. It's going to be running now through August the 23rd only. So if you want to get into PEMFs, this is the perfect opportunity to do it with 20% off. Beyond that, just make sure to like the video, comment down below, and subscribe to the channel to stay updated on the new videos that come out each week. We'll see you next time.